I don't agree with that at all, because in Jamii Bora, we know that you can reach the very poor. And not just reach them and feel sorry for them and pat them on the head and say, you know, we are going to help you to come above the poverty line. If you think this is the poverty line now, you want to lift them just above the poverty line. Our experience is, first of all, that the most desperate are the ones who need microfinance the most. And they can handle it. And we have proven that. It's not something that is a theory. It is a proven fact. And that they are not climbing only just above the $1 a day. They shoot up very high. They've become, some of them, extremely successful business people. Early 2001, we were 1 year and a few months old. We now realized we had some people who were not paying. They were falling behind in their payments. So we decided to make 100% research. We would visit every single one of them with our staff and try to note down what are your problems, why can you not pay. And we found that it was such a shocking result, 93% had the same problem. They had a patient in hospital. That's a very Kenyan expression, I have a patient in hospital. It means my son, my daughter, my baby, my grandchild, or my spouse, or my sister, somebody very close to me had to be admitted in hospital, otherwise they would die. Now, of course, you can't expect that anyone will let their child die because they have to pay their loan to Jamii Bora. So it was clear to us this was something we could not compete with. This was something we had to solve. And so we went to all insurance companies and asked, could you develop an insurance product for us? They said, oh, yes, yes. We had 6,000 members in those days, and they thought that was a lot. But you know, the cheapest of the cheap that they could come up with was way, way above what our members could even dream of affording. Their price was 6,000 shillings per person. And 6,000 shillings is about $80 per year. And $80 per year, if you are a single mother with 5 children, you see, you have to take times 6. That is a lot of money. That was way above what anyone could even dream of. Now we then decided we start our own in-house product. Everybody told me, now, Ingrid, you are really killing this beautiful organization. This will pull you down, it will not work. But we never did any research. We sat in a group of staff with a lot of knowledge about our members, and we decided that we could charge 1,000 shillings per year, which was $12 at the time. And on condition that the members could pay every week a small amount, and they didn't have to pay everything up front. And we decided that it would cover an adult member and a maximum of 4 dependent kids. If they had more than 4 kids, they would add an extra $2 per child per year. And we would cover inpatient, that is treatment in hospital. But if they came into hospital, we'd cover everything. And we started by linking up with one of the big mission hospitals in Nairobi. And we say we give you a deposit, what we think it could cost per month. So, because mission hospitals cannot afford to give you services on credit. So we paid them up front. And then our patients would come with a letter from us saying this patient has a health insurance from us and please treat her. If she has to be admitted, we will pay everything. And there was not more research than that. The background was this is what our members can afford to pay and we have to get it to work. And over time, this has now become the most incredible part of our organization. We also decided we wasn't going to ask for any donor funding, because then they would send a lot of consultants and tell us that it was not possible to do what we had decided to do. And they would also say that so-and-so should qualify, those ones could not qualify, and we wanted it to be for everybody. So we decided it would cover maternity, it would cover any kind of operations, it would cover any kind of inpatient treatment, and we would not exclude people with HIV and AIDS, because then it was a useless insurance for us. And today it is soon going to be 7 years that we have run this. We have always covered all our costs. We have never had any donor subsidy, not even $1, and we have never asked for it either, because I'm sure we would have got it if we had asked. And it has saved so many lives. We have grown to be the largest microfinance organization in Kenya, and yet we are supporting the poorest of the poor, and they are very many. Now we think we're ready to grow. We have held back on growth a bit because we needed a new MIS system in place. We needed a technology to be networked with the whole country, which we are today. And we have reached 25% of all the households in 2 of Kenya's worst slum areas, Mathare Valley and Huruma, next to each other. So we have said, now let's make that our target for the whole country. So our target is to reach 25% of the households, 1.5 million households in 10 years. But many of us think we should reach that goal earlier than those 10 years. And we think it's possible.